Yeah, so let me tell you, what I usually do is kind of start by talking about chromosomes.
Okay.
So this is what the chromosomes look like from a single body cell. If we wanted to study chromosomes for one of us, we would just take a blood sample. Any of the cells in your body that have a nucleus are gonna have a whole set of chromosomes. So what we'll tend to do is take a blood sample, grow cells in the laboratory, look at the chromosomes under the microscope and get a picture just like this.
Okay.
Now, to get a chromosome picture like that from your babies wouldn't be so easy because we would have to get a living cell sample from them. So to do that, we would have to do a test like amnio.
Right.
So the reason amnio gives us a full chromosome picture is that we're getting this sample of fluid from around the baby that would have the baby's cells floating in it that have just naturally come from the baby's body. And then you can grow those cells in the laboratory, look at them under the microscope and see the full chromosome picture.
Okay.
The issue with amnio, or one of the issues with amnio, is that there is a risk with it because when we're doing that test, we're putting a hole in the sac that's around the baby.
Right.
That does cause a concern or a risk that there could be fluid leakage, that there could end up being a complication that could potentially lead to miscarriage. And the risk that we would normally quote with an amnio is 1 in 400 risk of pregnancy loss.
Okay.
If you have twins, and if we had someone come to us and say, well, because of my age, I'd like to do an amnio for both of my twins, then we would have to double that risk because it would be a 1 in 400 risk for one baby and a 1 in 400 risk for the other baby as well. So it would be 1 in 200.
So you couldn't just poke. You have to poke.
You have to
both.
test them each, yeah.
Okay.
To test them each. So
Oh,
if we ever have a situation where one baby has a health problem, like we see a heart defect, and we just want to test one baby, we could. But if someone was just coming in for screening and saying, well, I'm just concerned because of my age, I would like to have my baby be tested for these conditions, then yeah, we would have to test them each because are your twins not identical? They're fraternal.
It's yes,
Right.
I know for
Right,
I
yeah.
think that blood test would tell me.
It did. It
Okay.
showed that. Yeah.
Okay.
I just was making sure you knew that. Yeah.
Right, because
yeah.
I read
Mhm.
somewhere where people were told they were fraternal, but then when they were born or somewhere later down the line, they found out
Mhm.
they were identical because the egg split at a
Right,
certain
so
time.
early,
So I didn't know
yeah.
if the genetic test
Yeah,
revealed
the
that.
genetic test is straightforward, and that
Okay.
did show fraternal.
Okay.
So yeah, so that we've never had the ability to do that prenatally until very, very recently. So like
Okay.
anybody that, if you look at anybody's like experience from a year ago even, we didn't have, the test didn't even tell us then that
Oh.
fraternal versus not fraternal, so that's been pretty new.
Okay.
So yeah, but it is very straightforward because they're looking at the DNA from each baby and they don't match because identical twins would basically have the same DNA.
Right.
And so they definitely saw two different patterns, so it was
But
not
fraternal
identical.
can be two boys or two girls.
Mhm, yes, yes,
Okay.
right, it can be, it doesn't tell you anything about gender.
Oh,
It just tells us that they are not, they're not, right, they're not identical, they didn't come from one egg that split.
Okay.
They both were conceived separately and just
Okay.
ended up there lucky in the same place at the same time.
Right.
So, yeah, for all of time now, right? So, yeah, so if you look at somebody's chromosomes, this is what we would see, and if we study them, what we tend to do is take a picture like this, and then line the chromosomes up pretty much in size order, from largest to smallest. 1 through 22 everybody has, and then the last pair is the sex chromosome pair. So if you're carrying a little girl, she would have 2 long X's, and if a baby is a boy, he would have an X and a Y like that.
Okay.
When we look at the chromosomes, what we expect for a baby is a normal pattern. That would tell us that, like this person from this picture, 23 chromosomes came from mom, 23 came from dad, and the right number ended up being there.
Okay.
When we see a chromosome abnormality for a baby, the syndromes that are the most common are the ones where there's an extra copy of a chromosome, and the most common example of that is an extra 21. So an extra 21 causes Down syndrome. So a person who has Down syndrome, if we did their full chromosome test, this is what we would see. We would see 3 21s. Now what they were doing with the DNA blood test that you had is we get this sample of blood from the pregnant mom, and that will have DNA in it, what's called cell-free DNA. This is genetic material that has kind of broken out of your own cells. So all of us, like I'm not pregnant, but I would have that cell-free DNA in my blood, but it would come from like my kidneys and my spleen and my liver, like any cells in my body that are getting to the end of their life cycle, they're being kind of recycled in my bloodstream. And so we'd get pieces of all of that chromosome material.
Okay.
But what's cool is when you're pregnant, not only do you have your own cell-free DNA, but you have cell-free DNA from the placentas of the babies. So both of their placentas are going to be kind of shedding old cells, just normally, things that are finished with their life cycle. Those cross over into your bloodstream, your body's breaking everything down. And then instead of getting, again, whole chromosomes, it would be pieces of those chromosomes that we would get in that blood sample.
Okay.
Now, what they do with the version of the test that you had, it's called Panorama, and there are many different companies that do this test, but with the Panorama version, they actually are sequencing the little pieces that they get. When they do that, they can tell where each little piece came from, and then you can ask a question like, well, okay, how much material did we get total that came from chromosome 21? If they can come back to us and say, you know, we know, or we saw the expected amount of 21 material, then that is an excellent sign that the babies don't have Down syndrome. And they knew that you were carrying twins, and they know what to expect in terms of how much total 21 material to see.
Okay.
And so when they come back to us and say that, if it was a singleton pregnancy, the detection rate for Down syndrome is greater than 99%, and the reduction in risk would be down to less than 1 in 10,000.
Okay.
So they're not able to use that number if you have a twin pregnancy, because they haven't been able to collect as much data on twin pregnancies, and there can be some issues with kind of looking at everybody's DNA all in one sample.
Right.
So I think that the risk that they give you when it's a twin pregnancy, the risk reduction for Down syndrome is down to 1 in 4,000.
When you say
So-
the risk reduction.
So, yeah, good question. So that's going from your age-related risk, where you came when you first got pregnant, what we would have told you your risk was,
Right.
down to what it is now that you've had the test. So the
Oh.
chance for your baby, for each baby to have Down syndrome is 1 out of 4,000.
Okay.
So we'd have to find 4,000 people just in exactly your situation before we'd find one baby with Down syndrome.
Okay.
The other 3,999 women who got a
Right.
result like this, the baby doesn't have Down syndrome.
Right.
So, and to tell you about age-related risks, let me see if I jot down what my cheat sheet
I think
number,
that
but
word reduction is what's messing me up, but you're saying the risk
means that it went down. I
went
just mean it
down
went
the
down.
further along I am in my pregnancy?
No,
or-
it went down because of your test result.
Oh,
So your test
okay.
result, because it was so normal, so like, right, so
Okay.
what they saw was exactly what they expected to see.
Okay.
And so for every, and the risk is, the risk going down to that number is the same for everybody with twins who does this test,
Mhm.
if everything looks great.
Okay.
So
Okay.
everybody who's having twins, who does this test, and the risk comes back of looking, you know, everything comes back looking as good as they wanna see it,
Uh-huh.
then her chance for her babies to have Down syndrome will drop to 1 in 4,000,
Okay,
and that's
I
what
got
happened
you.
to you.
But
Yeah,
that
yeah.
doesn't mean that the risk is completely gone.
So they can't ever tell us 0.
Okay.
One of the reasons they can't is that we're not getting that full chromosome picture. So like if we
Right.
did a test like amnio, then we know exactly, we're looking at it. I mean, if a baby had Down syndrome, we would see it looking like this, and if a baby doesn't, we see it looking like this.
Mhm.
So it's not as straightforward when we do the blood test, because one of the reasons it's not is that what we're sampling is cell material from the placenta. So it's not directly from your baby's bodies, it's from the
Right.
placenta. Now the placenta and the baby, in almost every case, will have the same chromosome pattern.
Mhm.
So we would expect everything to be the same. So when we check out the placenta and it looks normal, we're gonna expect that that means that we would also not, you know, a normal pattern for 21, we would expect we would see a normal pattern for 21 for the baby as well.
Right.
But we're still a little bit limited because we're not testing that exact baby's body.
Right.
There are rare cases where the placenta and the baby could have a different chromosome pattern.
Mhm.
Where we tend to think about that more is in the opposite direction, where if we get a result back where it shows a problem, that it
Okay.
could just be in the placenta, and we
Mhm.
might test the baby and not find it in the baby.
Okay.
But it's possible, you know, that it's sort of in the category, in the way that sort of many things can happen and all
Mhm.
sorts of unexpected things can happen,
Right.
or rare things can happen. It would be possible for the placenta to have one chromosome pattern and the baby to have a different one. So
Okay.
that's really sort of my simplistic way of looking at why they can't bring it down to 0.
Okay.
It's not a diagnostic test, we're not getting the full picture. We are using another tissue that should reflect the baby's chromosomes.
Right.
So based on everything that they understand, they believe that based on all of that, the risk for Down syndrome is 1 in 4,000, is less than
Okay.
1 in 4,000.
But you would be more alarmed, I guess, if, like you said, if that test from the placenta showed that there was something
Right,
abnormal.
if it comes back with a concern, the concern is usually very high. So, so I don't know that I've seen it come back in a twin pregnancy, so I don't know what the exact number is that they quote, but for a singleton pregnancy, if it comes back saying, we saw more 21 material than we expected to see,
Mhm.
then the chance that that is a baby with Down syndrome is 91%.
Mm,
Okay, so
okay.
totally different, right, like way on the other end of the
Right.
spectrum. So that's how this test works. Happily, most of the time people get a result that's either very high risk, like that woman who would get the 91% risk,
Mhm.
or down to that less than 1 in 4,000 risk.
Okay.
So, so yeah, you definitely, basically everything that they saw looked the way they expected it to see, so it was all in normal range, and so you got the best reductions possible.
Okay.
And then again, reduction being a good thing,
Right.
meaning your risk dropped, it dropped.
Right.
And so the other things that they check for chromosome 13 and chromosome 18, and that's because a baby could have an extra chromosome 13, we call that one trisomy 13, and they give me a picture of trisomy 18, that's like that, 3 18s. Both of those usually cause a miscarriage early in pregnancy. These are also syndromes, and I should say if it doesn't cause a miscarriage early in pregnancy, there could be a miscarriage in the middle of the pregnancy, there could be a miscarriage even late, or a baby who could get all the way through the pregnancy and doesn't live very long. Now with these, same thing, they saw the normal amount of 18 for your baby, so let me flip back to the normal page, saw the normal amount of 18, they saw the normal amount of 13, what they were expecting to see. So the risk for each of those dropped to less than 1 in 10,000. Okay, so that, and again, these are all the standard reductions, so like another mom carrying twins couldn't have gotten a better score than you, like that's just the normal, when everything looks great, that's the score we see, 1 in 4,000 for Down syndrome, less than 1 in 10,000 for 13 and 18.
Okay.
So you got the best score possible.
Okay.
Okay, and then they did check the sex chromosomes. The reason they look at sex chromosomes is they wanna make sure there's nothing extra or missing for a baby.
Right.
That's a little bit more tricky when they're working with twins, but they were able to look at that. They didn't see anything that made them suspect a sex chromosome syndrome for the baby.
Okay.
And then they also looked at zygosity, which is whether they are from one fertilized egg or from two, and that's how they came back to tell us it was fraternal twins.
For sure.
Yeah,
Okay.
yeah.
Okay.
So as far as a non-invasive screen, this is the best thing that there is. I mean, there's nothing else that has the detection rates that we would believe that this would have even for a twin pregnancy. And then there are no other screens that don't have more of a false positive problem. Like you mentioned the quad screen earlier, that's one that has a lot of false alarms. So when we order that and it comes back showing an increased risk, most of the time that woman's baby really does not have that diagnosis, but it just leads us down a path of, okay, here's something else, another test we can do. So many times, it's controversial, but many times nowadays if somebody has an abnormal quad, they might choose to move on and do the test you did next, because to try to clarify more what's going on. And then, the official word is always that, like, the most thorough is gonna be diagnostic testing like amnio.
Right.
But like I mentioned, because there's a risk with it, not all of our patients want to consider that.
Right, and I thought about that, and then I had a friend I was talking to, and she said that most people aren't really doing that too much anymore because it supposedly causes cerebral palsy. So, I mean, I don't know, that kind of deterred me. And then, like you said, that test, I guess the longer I've been waiting to talk to you, the more I'm like, maybe I shouldn't do it. But but still looking at the risk, being that I'm 41 and it's twins, I don't know.
Well, now your risk though is not what it was. So your risk was higher before, and now your risk is 1 in 4,000 that they could have, that one of them could have Down syndrome, and less than 1 in 10,000 that they could have trisomy 18 or trisomy 13. So we wouldn't really be going by your age-related risks anymore. We're gonna go by the risks that came from that test result. Okay. So because that's what we were trying to address. So that's why when I use the word like risk reduction, your risk started out being the risk everybody has at 41. Now it's not that anymore. Now it's going to be the result that we see, the risk numbers that we saw from that report.
Right.
Yeah. And and again, there's this, because with twins, because they don't have as many twin pregnancies to work with and gather data and feel quite as solid about their numbers as they do with singletons. That's why I know that maybe in Dr. Bartlesmeyer's conversation with you, because I could tell in the note that was something he had communicated to you that just that it may not be quite as solid with twins. But the technology is really the same. They're looking at how much DNA they see, and they are able to differentiate between DNA, the difference in DNA between one baby and another, and between the two babies and their mom to some degree, because the babies are gonna have DNA from their dad. So they're gonna have different DNA strands than you have, but 50% of it's gonna be different. So the technology that they're using, in their minds, is pretty straightforward. They feel like in the sense that they feel like, well, we can see this here, we're looking at the 21 material, we don't see any extra, we feel confident in this. So they don't have the large numbers to be able to sort of prove the same detection rate necessarily, but it's a straightforward way of looking at it, and they feel very confident in being able to offer this with confidence to twin moms. So have felt comfortable ordering it, although, you know, again, we always have to, it's always with the caveat that we don't have, the data aren't as solid
Right.
for twins, but we feel comfortable ordering it.
So I know that Down syndrome and like the trisomy 13 and 18 are some of the biggest concerns, but there are other birth defects. Does amniocentesis tell you those as well?
So the blood tests that you had, like those trisomies and including Down syndrome, those are the ones that we have a higher risk for as we get older.
Okay.
So other birth defects you wouldn't have a higher risk for it as you're getting older, so it would be the same as when you had your other kids.
Okay.
So, if we do an amnio, what it does is it does give us that full chromosome picture, so the difference there would be that, unusual things can happen among the chromosomes, so like we could sometimes find a person who has like a little missing piece of chromosome material or an extra piece. That would be something that would be most likely to happen by chance.
Okay.
I haven't taken your family history yet, so I guess, you know, if there are a lot of miscarriages in a family or something, then sometimes we can think about chromosome problems in a family, but most of the time if we find an extra or missing piece of chromosome material, or at least much of the time, it'll be something that just happened in that person.
Okay.
There's nothing about your age that would make that more likely to happen. Okay, so if we did do an amnio for someone and we get this kind of a full chromosome picture, what we're able to say is not just this is a person who doesn't have Down syndrome, doesn't have those other trisomies, sex chromosomes are normal, whichever one they are. We can also say, well, we also looked at all the chromosomes, we didn't see anything extra or missing, everything looked the way it should.
Okay.
So, we would do that because we would have those cells. We're not especially worried that your baby would have something unusual like that, but once we have the cells in the lab, they're gonna do the full study.
Right.
They're gonna do the full look at the chromosomes and be able to say normal chromosome pattern.
Okay.
But that wouldn't be looking for anything that you have any increased risk for compared to other times you've been pregnant, unless there's something else in your family tree that we're gonna talk about, that we haven't talked about that would be a concern, but for most people, there's not gonna be any other special concern that we'd be worried about there.
Well, and that's
So-
what I was asking, not necessarily
yeah.
the age risk thing, but just any other.
Just generally, right. So those things that, you know, so we could, the times when we usually would do that full chromosome testing would be if we see abnormalities for a baby on ultrasound. So if we see a baby who has multiple birth defects or even just a couple things going on, we might become more concerned. This could be a baby with a chromosome abnormality. So that's a different way or a different time that we offer amnio. We might be offering it then because of what we're seeing on ultrasound.
And you can see that on the ultrasound, like, I know
Like
they
birth
said something about
defects?
extra fluid on the neck or something like that on the ultrasound, but you can see other birth defects on
Yeah, so there, you know, when they do ultrasound, the most well, usually a woman will have a comprehensive ultrasound at 20 weeks, and that's gonna be a head to toe look at the baby.
Okay.
And that's where they will look at the baby's heart.
Okay.
They'll be able to see the 4 chambers in the heart, make sure they don't see any holes between the chambers. They also do things like look to see that the baby's swallowing, so that we wanna see amniotic fluid in the stomach. That's normal, your baby should be swallowing their fluid.
Right.
And so we should see what's called a stomach bubble. It's just a little round image of the stomach.
Okay.
If a baby had a blockage where like the baby couldn't swallow, we might not see the stomach. It doesn't mean that it wouldn't be there, it would just mean that there's something stopping the fluid going down.
Okay.
We look at the kidneys to make sure they look normal. We should see fluid in the bladder because that tells us that the baby's kidneys are working. And if you see a normal amount of fluid in the bladder, that also tells us that the baby's able to pee, because that's important. And again, kind of checking for blockages.
Right.
And then they check up and down the baby's back to make sure they don't see a birth defect called spina bifida.
Right.
So that would be checked for, yeah, so those are all things they're checking for when they look at your baby. They look at arms and legs, hands and feet, fingers and toes. We wanna see kind of normal movement of the hands.
But that's not
normal shape of
chromosomal
things.
stuff, that's.
Right, that's physical.
Okay, physical,
But if
right.
we saw a baby who had, let's say we saw a baby who not necessarily had one thing going on like that, but had a couple of things. If I saw a baby, we saw a baby with a heart defect and, you know, and a kidney abnormality and something else going on, then we might start to think, well, this could be a clue that there's something bigger happening with this baby. And that's when we think about chromosome problems.
Okay.
So that's why in that situation, we might be seeing a woman who's 25, so no age concern, but once we see those problems for her baby, that would be a time when we would offer amniocentesis to her.
Okay.
And then we're thinking, okay, there may be some likelihood that we're gonna see something abnormal in that chromosome report.
Okay.
Now, if we do an amnio for a woman who's, you know, just because she's 41, we're not really expecting that we would see that kind of unusual chromosome abnormality, where we wanna check out Down syndrome and trisomy 18, trisomy 13, make sure we don't see anything extra. But we would be surprised if we got a report back that said, oh, actually, there was a missing bit of chromosome 10 or something like that. It's not, you know, again, in the you know, in the sort of, you know, general realm of anything can happen, it could happen, but we would certainly not have any reason to have been worried that was gonna happen for her, if that makes sense.
Yeah, so my last couple ultrasounds they did, like, they were pretty in-depth, but I was still not far long enough for them to see all the stuff that they might see at the 20 week.
Right.
Okay.
And if, when's the last time you had an ultrasound? Oh, it was just recent, right?
Yes,
it's
it's like
yeah. So that, they can start to see a lot by now, but they're always going to tell you that they're limited in checking out the baby's hearts until about 20 weeks. So 20 weeks is the time when they
but I don't think
they see it. No,
it.
they probably did examine it as much as they could.
Right.
But the issue is that those hearts are still tiny. So when you come in at 20 weeks, the baby's hearts are going to be a good enough size that they're going to feel much more confident in being able to check those things out. So they still do look at it, but they'll kind of look at it and say, like, well, we don't see a problem, keeping in mind that the baby's heart's still kind of small for us to do a really good look. So the really good look is going to start to be able to be possible at 20 weeks.
Now, at this last one, they did say something about a cyst on one of the baby's brains. So, but the doctor said that was nothing to worry about. It usually goes away, but that's not an alarm for concern.
No, not if you've already had the cell-free DNA and it looked good like yours did. So what that might be, there's something called a choroid plexus cyst. Does that sound like words they use? Or a CP cyst? So what that is a little cyst that is in an opening in the baby's brain. So it's not in the baby's brain tissue. It doesn't push on the baby's brain or anything like that. It's out, there are these openings in our brains where our fluid, the cerebrospinal fluid runs, and it kind of runs up from your back and back and forth between your spine and your brain. And you can see a cyst called a choroid plexus cyst that can develop there, and it's completely benign. It's totally harmless. It's just a little fluid-filled sac. Some people will call them, I've heard doctors refer to them as a pimple in the brain, and it sounds like a weird thing, but the reason they like to say that is to emphasize to patients that it's as harmless as a pimple. Like, it's not going to do anything. We expect it to go away. It's not impinging on the baby's brain. And if we see that, and a woman hasn't had any testing yet, like you had, then babies who have trisomy 18, they have a higher chance to have that kind of cyst. But the vast majority of babies who have that kind of cyst do not have a chromosome problem. So when we see that and your screen has already come back great, that's why they just kind of blew that off and said that's not, we're not going to be worried about that. And they kind of have to tell you everything they see. So, you know, they kind of blessing or curse, I don't know.
Tell me that if I need to worry about it. I was like, he needs to disclose it.
Yeah, there's right. They have to let you know everything they see. Yeah, they really should.
Well, so, one more question. As far as, like, if I did decide to have the amniocentesis, I do have fibroids, and I know they're in certain places, so would they still be able to do it around those?
They would. So what they would do, well, they would hope to. I mean, what they would do would be to use ultrasound, look for a pocket of fluid that's away from the baby, that's going to be kind of a safe area to go into, and they would also be looking out to avoid those fibroids at the same time. So I don't do amnios myself. You know, I'm not a doctor who does those, so I don't know if, like, could be a situation where there might be so many fibroids in an area that they might say, like, oh gosh, we just don't have a place to go in here. I guess that could be possible, but that's not common. Well, let me ask you a few family history questions. I didn't ask you about your other kids yet. Are they doing well?
They're doing good.
Any, like, health or learning issues? Oh, yeah, do that.